This meeting is now being recorded. Well, hello. I'd like to welcome you to our webinar about the Colorado Interagency Coordinating Council. This is our orientation call. So unfortunately, at this point, we didn't have anybody sign in to the webinar, so we're just going to go ahead and do it because we want to make sure that it's available for you to listen to at a later time. So we're recording this and going through the information. And so I have with me Christy Scott, who is our Early Intervention Program Director. My name is Wayla Murrow. I'm the staff to the CICC. And I also have with me Tracy Sperry, who is also staff to the CICC and works with logistics and mileage reimbursement and getting hotel rooms. So you're all going to love her for sure. So let's get into our content. So first of all, we just want to say thank you so much for your participation. We know that it is a time commitment and it's taking out of your personal structure and time, but we really, really appreciate your sharing your expertise and just thank you for your willingness to serve. So we have great appreciation for you, so thank you so much. So I asked you to read the bylaws ahead of time to take a look at those, and if you haven't seen those, they are on our eicolorado.org website, and if you go to almost any tab, I usually go to the Provider tab, and then there's a button that says Colorado Interagency Coordinating Council. You can find information there. So we do try to keep that updated, and the bylaws are there as well, and all of the orientation materials, in fact, will be there, and we will post this webinar there as well. But it's really important for you to read the bylaws because we do try to operate by those, and they present our guiding values, they present information about membership, which is important when toward the end of the year we'll be looking at membership, we'll be trying to gather information and sorry, I'm just moving the microphone a little bit closer so I'm making sure that hopefully you can hear on this webinar. But it gives information about the composition of our council and all of that sort of thing. So this is what we go by. We follow this in order to do our business. So please make sure that you take a look at the bylaws, and if you have any questions, I am happy to answer those for you. So first of all, we're just going to give you a little history lesson about our program, about early intervention in general, and how we came to be for the CICC. So Christy is going to start by providing you some information about our lead agency, the Office of Early Childhood, and the CICC.
Thank you, Wayla. First, we're going to start with a little lesson on the Office of Early Childhood. And the Office of Early Childhood has a mission, and the mission is that we believe all children are valued, healthy, and thriving when investment occurs in their early years and they receive access to opportunities where they can learn and grow. We insist on the highest quality early childhood experiences with a firm commitment to family and community. So the Office of Early Childhood also has goals, and the goals are that we provide resources for children, families, and early care professionals to best prepare Coloradans for future success through access to collaborative, coordinated, quality early childhood programs and support. And we also have a list of strategies. And our strategies are access to resources for healthy development, learning, and support, coordinated systems, connected partnerships for service delivery, relentless focus on quality and continuous improvement, financial sustainability, and values-based teamwork to strengthen our kids and families. The Office of Early Childhood is new. It hasn't been around for very long, and Governor Hickenlooper created this office in June of 2012. We consolidated and streamlined early childhood programs in Colorado to create a high-quality early childhood system and wanted to ensure that families and early childhood professionals across the state had access to necessary supports to ensure children are ready for kindergarten. We also wanted to increase access to quality childcare and early learning services for all children. He realigned many programs that were already within the Colorado Department of Human Services. This was a House bill. It created the Office of Early Childhood, OEC, and it brought together the Early Childhood Leadership Commission, Nurse Home Visitor Program, Maternal, Infant, and Early Childhood Home Visiting Program, the Colorado Children's Trust Fund and its board, and the Head Start Collaboration Liaison. These were the original programs that were included. The structure of the OEC, which starts at the top with the Colorado Department of Human Services, and then within CDHS is the Office of Early Childhood, and within our OEC, we have two divisions. One is the Division of Early Care and Learning, and one is the Division of Community and Family Support. And that's the division that we are in. Along with the Early Intervention Program, you can see the programs that are included in what we call DCFS, and we have the Child Maltreatment Prevention Unit, the Early Childhood Mental Health, our program, the Early Intervention Colorado, Head Start Collaboration Office, and Home Visiting. We broke out one of our units, the Child Maltreatment Prevention Unit, because there are several programs that fall within that particular unit. And those programs are the Colorado Children's Trust Fund, Colorado Community Response, Safe Care Colorado, Family Resource Centers, and Promoting Safe and Stable Families. So even though we have quite a few units in here, there's more programs than really show on this on a cursory look. So then we also have the Division of Early Care and Learning. And the Division of Early Care and Learning, DECL, has the Child Care Assistance Program, which we call CCAP, Child Care Licensing and Administration, and the Child Care Quality Initiative. So here's a little visual on what we call our comprehensive early childhood system. You can see that our system works with all aspects of early childhood development. We've got parenting and education in there. We have prenatal care, child care, and we also which is preparing children for kindergarten all the way through third grade. We have social emotional development that we're addressing. We address health and nutrition, higher education, and professional development for early learning professionals. Let's take a look at the way the early intervention program is set up. We have three units within our early intervention program. We have our general supervision and data unit. We have our program initiatives, and we have our fiscal accountability. We had an infrastructure change a while ago to align these three units so that we would be able to do our work in a coordinated yet organized fashion.
So I see, Jennifer, that you joined our webinar, so thank you. We're really happy that you're here. We went ahead and started our webinar, and when we finish it, we'll have it totally recorded, and then you can go back and listen to the very first parts of it. But if you have any question or anything, feel free to write in the chat, and we're happy to answer any questions for you.
So the team structure that we have in place allows for additional leadership development as part of a succession plan. we wanted to have an organized structure so that the structure of the program wasn't dependent upon people, but we have a way to set it up so that as people leave, which sometimes happens, we have an organized way that we could succeed them. We have an intentional focus on the cohesiveness and integration with effective supervision levels. And then the structure also allows the director to be involved in integration activities across the programs in the Office of Early Childhood and not be so focused just on our program. Since the creation of the Office of Early Childhood, the public awareness of the early intervention program has really increased dramatically. The number of calls to our 1-800 number for referrals has doubled. It went from 400 per year to 800, and referrals have increased by approximately 19% in just 1 year. The growth rate in the average number of infants and toddlers eligible and receiving early intervention services went from 2% to 5.9% in 1 year, and we've been holding steady at 6%. Our program serves over 13,000 children each year. Here's the website for the Office of Early Childhood and also the link to our Early Intervention Colorado website.
Thank you, Christy. Now we're going to talk a little bit about how we got here in terms of our federal program and what we mean when we talk about Individuals with Disabilities Education Act, IDEA, which is the federal law. Our program is partially funded through the federal government under the Office of Special Education Programs, and sometimes you'll hear that called OSEP. In fact, we refer to that a lot because we need to report to OSEP a lot of our data. And we also receive funding from the state of Colorado through the State General Fund. But because we receive funding through the Office of Special Education Programs, federal funding, we're really required to follow all of the federal rules and regulations, and we have to report data to the Office of Special Education Programs at least yearly, but sometimes more frequently than that. So I'm going to talk to you about the federal law and its requirements so that you can understand why we do some of the things that we do and some of the requirements that we have in early intervention. This is just sort of a graphic of the history of public policy. As you can see, we have a long history going all the way back to 1954. And really there are two themes that are represented in this wave of legislation. One is about civil rights, and the other is about educational opportunity. All of these laws either talk about the civil rights of people, either of different races or different economic groups, and also those with disabilities, or it talks about educational opportunities for some of those same groups as well. It's a rich history, and in fact, in 2015, we celebrated the 25th anniversary of ADA, which is the Americans with Disabilities Act. That's a civil rights law that provides access and rights for people with disabilities to all public buildings and programs. 2015 was also a year where we celebrated 40 years of IDEA, the Individuals with Disabilities Education Act, that provides special education services for children, birth to 3 now. It started out at 3 to 21. We also celebrated in 2015 50 years for the Head Start program and 50 years of the Medicaid and Medicare program. So as you can see, 2015 was a landmark year where we celebrated a lot of anniversaries in our early intervention. The general intent of the Individuals with Disabilities Education Act is to ensure that children with disabilities have equal access to public education and are prepared for employment and independent living. So often when we think of children in our program who are birth until they turn 3 years old, it's kind of hard to think about that employment and independent living, but really the skills and the help that we're providing to families is really for that purpose, to help them and helping their children and their family, and helping their children to be able to. Hey there, is it Jennifer? How are you?
Fuck that shit, dude. I'm just kidding. Yeah, it had already told me, so whatever.
Hey, Jennifer, are you on the line, Jennifer? Okay, sorry about that. We're hopefully won't have that distraction again. Oh, anyway, my point is thinking about children who are birth to 3. We're still working toward that same goal of them living independent lives and having meaningful employment as well in the future. This is a quote from the Individuals with Disabilities Education Act, and many times you'll just hear that called IDEA or IDEA 2004, because the latest big reauthorization was in 2004. This quote says, "Disability is a natural part of the human experience and in no way diminishes the right of individuals to participate in or contribute to society. Improving educational results for children with disabilities is an essential element of our national policy of ensuring equality of opportunity, full participation, independent living, and economic self-sufficiency for individuals with disabilities." And I love this quote. I think that it's beautiful, and it really shows that our national policy is really in place to make sure that all people have equal opportunity, are able to participate in their communities, they're able to live independently, and they're able to support themselves and their families. So that's what we're striving for, even when we work with children who are birth to 3 and their families, thinking about that for their future. So this is just a little graphic of the Individuals with Disabilities Education Act. It's made up of 4 parts. I always say they're cleverly named: Part A, Part B, Part C, and Part D. Part A, it gives general information about the law, why the law was enacted, and who it serves. It also gives definitions for terms that are referenced in the law, and it defines what the state and federal government needs to do administratively. Part B of the law is the section that requires states to conduct child find activities, which means that they're supposed to locate and conduct evaluations to determine eligibility for children who are birth to 21. And it serves students through the semester in which they turn 21 years old or when they graduate with a regular diploma. It contains the preschool provisions for children ages 3 to 5 generally. It sets forth the principle of FAPE, free, appropriate public education, and LRE, which is least restrictive environment, and it also has the child find requirements, as I said. Part D of the law authorizes discretionary funding for a variety of activities, such as research and innovation, personnel preparation, technical assistance, dissemination of information. And so examples of this kind of funding are, in Colorado, are Peak Parent Center, which is our parent training and information center, and also it funds some teacher preparation grants at some of the Colorado universities. But Part C of the law is what we are under, and you'll sometimes hear early intervention referred to as Part C and vice versa, but Part C actually refers to the federal law, the part of the federal law that provides the federal funding. And early intervention, Colorado, is really a much larger system because we operate not only with federal funding, but we also operate with state funding and other funding as well. And so really early intervention Colorado is much bigger than Part C, but sometimes you will hear those being used interchangeably. So just when you hear that, just know that Part C is actually referring to the federal law, and early intervention Colorado is really the system in Colorado that contains the federal law, but also much more. So hi, Deb. I'm glad you were able to connect. Thank you. We're recording this, and so you can go back and listen to the first part of this webinar just to get some of the history and information later. So thanks so much. We're so glad you were able to join in. So the purpose of the early intervention system in Colorado is to enhance the development of infants and toddlers with disabilities and to enhance the capacity of families to meet the special needs of their infants and toddlers with disabilities. When the early intervention provisions were added to the law, the importance of building on the capacities and strengths of families was recognized within the law. And so the intent of early intervention is not just to help the child make developmental progress, but to support their child in helping them, to support the family in helping their child access opportunities for developmental growth within their chosen activities. So Deb, you're saying that you can't hear anything. Are you connected to the phone? Oh, I guess we can't hear. That doesn't help. Okay, so I've asked Deb a question if she's connected to the phone, so we'll see if she answers that. So our approach with early intervention is really not only about the child, but it's also about helping the family and helping the family to increase their capacity to support their child's growth. Okay, so Deb's going to connect to the phone, I think. We'll see what happens. So the next thing that we're going to talk about is the funding in Part C. How do Part C funds flow? So in Colorado, the federal funds come from the federal government. They go to the Department of Human Services, the Office of Early Childhood, as Christy explained before, and then the Division of Community and Family Support, which is the division that we're in the Office of Early Childhood. And then we disperse that to the local communities, urban, rural, mountain, suburban, all of those. We disperse those to 20 community-centered boards throughout the state. And so because we need to follow the federal regulations, I'm going to tell you some of the required components of the early intervention system that we need to follow. These are federal requirements, and so these are the things that we do. We have statewide public awareness. Included in this, we have brochures, we have videos, we have a toll-free number that families can call. We also make sure that children are identified. We do this through the school district or child find in each local community. And some of the community center boards have many different school districts that they work with and many different child find teams that they work with, and some just have one. It really depends on the community center board. We have a central directory of resources. This is actually at our website, eicolorado.org, and so we try to keep that updated and try to keep a lot of great resources on that. We are required to collect data, including the number of children and how they are served. We also collect much more data than this, but that's one of our requirements is data collection. We are required to have personnel development standards. And so we have pre-service and in-service training for our personnel, and you'll be hearing about that at the CICC meetings because we're working on sort of changing how that's done at this time. So you'll be hearing about some of those changes as well. We do evaluation and monitoring. This includes on-site, going on-site and monitoring in the local communities. It includes desk audits of data, meaning we look at data from the communities that come in, and we also have focused monitoring, which means sometimes we're looking at specific areas, specific aspects of the early intervention program and focus on those. And we are required to equitably distribute the resources, and we do that through the 20 community center boards in Colorado. You'll hear those called CCBs. We use that acronym a lot. And again, if you hear us say acronyms that, especially during the meetings that you don't know, please let us know, because we want to make sure everybody's understanding what we're talking about. And then we're also required to make sure that children and family have their entitlements, which are their rights and their procedural safeguards. And so this is going to tell you what those are. Children and family are entitled to a multidisciplinary evaluation and assessment. They're entitled to an individualized family service plan, an IFSP, if they're eligible for services. They're entitled to service coordination. They're entitled to receive those services in natural environments. And so that's important, an important differentiation that early intervention has, that we provide services in natural environments, which are environments where the family and the child would naturally go if their child did not have a disability. We want to think about those places. And then, of course, their procedural safeguards and their rights. These are provided to families who are eligible at no cost under the Individuals with Disabilities Education Act. So who is responsible for the system of early intervention? The lead agency is responsible for assuring the required components are met, all those things that I just listed. And our lead agency is the Department of Human Services, the Office of Early Childhood, and the Division of Community Family Support. So they're the ones that make sure that we're meeting our requirements as a state. The local community center boards and their local interagency partners are responsible for assuring the local implementation. So they make sure that that in the local community, those things are happening. And then service coordinators, who are employees of the community center boards, are responsible for assuring that individual children and family receive their entitlements. The state demonstrates that our assurances that we are providing these things through the state plan for implementation of Part C, which is submitted to the Office of Special Education Programs, OSEP. And so this is the Colorado State Plan. It includes policies and procedures for carrying out these assurances. When you get your notebook for early intervention being on the CICC, we'll include a copy of the state plan in that, so you'll have it to read, but it's also available on our website. It's an important document because it tells the federal government how we're going to meet the requirements that they have set forth. Each community center board must also have a local interagency coordinating council, so we call this the LICC, and they do the same thing in their local community to make sure that the early intervention program is meeting the assurances for the local community. So when we think about the state level responsibilities, particularly for the Colorado Interagency Coordinating Council, the CICC advises the Department of Human Services, and they also they advise the department regarding early intervention programs and that sort of thing. We have certain things that we must do based on our state plan and based on our improvement plan that we have, but we ask the Colorado Interagency Coordinating Council as a advisory group to help advise us in those things. And then we have the Memorandum of Understanding Subcommittee. This is a committee of the state agencies, the representatives on the CICC that are members of these state agencies that help us to make sure that we have memorandums of understanding with those that are responsible for the different state agencies. So this is a picture of those. We have the Education Department, the Division of Insurance, because we work, we receive funding also through insurance of families and that sort of thing. We have someone from the Department of Human Services, the Department of Public Health and Environment, and the Department of Healthcare Policy and Financing. So this is our, we call it our Memorandum of Understanding Subcommittee, or our MOU group. And they're responsible for also making sure that we are implementing the required components of Part C. Just as a note, sometimes the Department of Public Health and Environment, you'll just hear that called the Health Department, and the Healthcare Policy and Financing Department, you'll hear called HICPUF a lot of times. So when you hear those terms, we're talking about those state departments. So in Colorado, the lead agency is the Department of Human Services, and they assure implementation of Part C. And the Early Intervention Program is a part of the Division of and Community of Family Support, which we talked about already. And the Early Intervention System is called Early Intervention Colorado for Infants, Toddlers, and Families. So that's how everything sort of fits together. So you'll be hearing those terms and about these different departments and divisions in our meetings. So we want to make sure you understand how we fit within all of that. So, as the CICC, the members are appointed by the governor, as you know. They set the policy direction for the system of early intervention, and they advise Early Intervention Colorado in our implementation. And so, just a friendly reminder from the Department of from the Department of Human Services, we want to make sure that you take the boards and commissions training. This is required by the Department of Human Services for all new members of any of their boards. And so although we do this little orientation webinar specifically about early intervention, this training is really about being on a board or council or commission through our department. And so they require this as a training and then a quiz. I took the training and the quiz, and it probably takes about 30 to 40 minutes-ish to go through the whole thing and to get 100%. You don't have to get 100% though. Just make sure you take the quiz. Like I mentioned, the LICCs, the Local Interagency Coordinating Councils, some of these members include the community center boards, the local health department, school districts, Head Start, social services, early childhood council, parents, and others. In many communities, the early childhood council also functions as the LICC, so it really just depends on how that community works. And they are responsible for advising the community center boards in their local implementation of state and federal regulations through the system of early intervention. So we have some federal reporting that we must do. And so I'm going to turn it back over to Christy, our program director, and she's going to talk about some of this federal reporting. And the reason that we talk about this in this webinar is because this is a huge focus of our work, both in early intervention in our staff and our program, but also in the CICC. And we're going to be talking at our planning meeting about these things, and so we want you to understand the terms and why we are talking about them.
Thank you, Wayla. So we have, as Wayla talked about earlier, we do have a responsibility for reporting data to the Office of Special Education Programs, OSEP, and we also report through our data. We have some targets for many of our measurements, and we have to report where we're performing on those targets. The State Performance Plan, which we call the SPP, we submitted in 2013, and it's a 2013 through 2018 plan This is the plan where we set our targets on specific indicators that we're required to report on. So had you been on the CICC during this time period, you would have participated in helping to set the targets for those improvement activities. We also, as part of the new state performance plan, it included a state systemic improvement plan. We call it the SIP, and you will hear us talk about this frequently. We submitted this plan April 1st, 2015, and it drives everything that we do right now. We submit the state performance plan annually if we make any changes. We do have the options if things are not going, as we predicted and we need to adjust some targets or we need to adjust some of our strategies for implementation, we can rewrite those and resubmit the state performance plan each year. We have an annual performance report, which we call the APR, and this is submitted annually on February 1st, and this is how we actually report to the OSEP about how we did towards our targets. And we have several indicators that we report on that we are expected to have a 100% target for, and some of those are your basic rights that families have, such as getting into services in a timely manner, getting the IFSP written, having services that are written on the IFSP start within 28 days, and also assistance to families in transitioning their children when they get close to the age of 3 and are getting ready to move out of early intervention. And each year we have public reporting, and we report annually on our website and to the public on the performance of every early intervention program. So all 20 of our community-centered boards get essentially a report card and it's posted on the website so people can see how they're doing. Our state performance plan evaluates our efforts to implement the requirements of Part C, and it specifies for each indicator what our targets are. And the annual performance report, as I said, just reports on our progress towards those targets. And these are the indicators that we report on and that we set targets for. And there are 11 of them, and they include early intervention services in a timely manner, the natural environments that we talked about before. We also have child and family outcomes, and we also report on the child identification. So how many children did we identify, and we break that out in children age birth through age 1 and children identified birth through age 3. We have a 45-day timeline for ensuring that an evaluation and eligibility is determined and an IFSP meeting is held. We have transition, and if we have any complaints from families, we have a very specific process we have to follow as far as hearing requests and mediation, and then our state systemic improvement plan. The SIP is a multi-year plan, and it's guiding the development of strategies to increase Colorado's capacity to structure and lead meaningful change in early intervention programs and providers. This is a plan that every state has submitted to the OSEP. Our plan is really focused on results-driven accountability. We have done very well on compliance of those indicators we talked about, and all the states have. So the OSEP has charged us with moving our focus from compliance to quality, and we're focused on results. And so RDA is how we refer to this, and it's aligned to support states in improving results for young children and students with disabilities. And the RDA balances the focus on improved developmental and educational results and functional outcomes for young children while considering compliance as it relates to those outcomes. So not just did you meet a timeline, but are meeting those timelines making a difference in the quality and the results that children and families are experiencing. We have a state-identified measurable result, SIMR. So as Wayla said earlier, we use a lot of acronyms in our work, and so we don't expect that you will remember all this, but you will hear these terms used over and over again. And our SIMR is infants and toddlers who receive early intervention services in Colorado will demonstrate increased growth in the use of appropriate behaviors to get their needs met. And the CICC played a huge role in the selection of our SIMR and our improvement strategies. The components of our ESSA, we start at the top. So if you start at the top and you say children are going to use their appropriate behaviors to get their needs met, well, how are we going to make that happen? And the next tier down are we need IFSPs with meaningful and functional outcomes. We need to ensure that families are engaged, and we need to give children the opportunity to practice their skills and achieve their outcomes. And so you can see another third tier under the IFSPs with meaningful functional outcomes. And we have 3 improvement strategies that we are focused on. And one was the development of a new data system, which has occurred, but continues. We continue enhancing that. The child outcomes process is integrated into our individual family service plan process. And we're working on ensuring that family assessments are conducted to fidelity. So November 1st, our annual report to the General Assembly, our Joint Budget Committee, it's one of our state reporting. So we've talked a lot about our federal reporting, but this is one of the reports that we actually have to submit to our state leaders. And then we also have a monthly CSTAT meeting that we report specific performance measurements to the Department of Human Services.
And CSTAT doesn't stand for anything. I always ask that, what does it stand for? And it doesn't stand for anything, it's just CSTAT. Maybe Colorado statistics or something, but we don't really know, but they just call it CSTAT. So thank you, Christy. We wanted to give you this orientation as far as the background and the reporting so that you'll understand why whenever we are in our CICC meeting and we're talking about the SDIP, we're talking about the improvement strategies, we're talking about how we're doing and what we're doing on these improvement strategies, that you'll understand that all of the reason we're talking about it is because that is the work that we're doing. We're really entrenched in this work and making sure that we're evaluating this work and that sort of thing, and so we want the CICC to be in the loop about what is happening. So you'll hear a lot about that at our planning meeting and meetings coming up throughout the year. Now we want to talk to you a little bit about logistics for both the planning meeting and any of the other meetings that we have throughout the year. We want to make sure that attending these meetings don't cost you money. I know it's costing you time and that sort of thing, but we want to make sure that you're reimbursed, and if you need to stay overnight in hotels or that sort of thing, we want to support you in that. And so Tracy's going to talk about this in a minute. She's our program assistant, and so she helps with all of that. And we just have a couple of pictures of some of our CICC meetings that we've had in the past with some of our members and some of our work, so I was just going to show you these. This is one of the meetings that we had at North Metro Community Services. This was one of our planning meetings. There in the front picture are Shannon and Alex. They were 2 of our co-chairs a few years back. On the left, you'll see Marcia. She's one of our co-chairs, one of our parent members, and one of our co-chairs for the coming year. In the picture back on the top, you can see me standing there with my hands in my pockets and my name tag there. I don't know if you can tell, but that's me. And we have we like to have a good we like to have an enjoyable time at our CICC meetings. We don't want it to be drudgery. So Tracy's going to talk about a little bit how to prepare for our quarterly meetings, and we appreciate your RSVPing and all that sort of thing, so she's going to talk about that.
Okay, so I am happy to make hotel reservations for anyone who needs them for meetings. I will usually send out a request to ask you to please let me know if you need a room and what nights. This can be the night before the meeting, and if you're coming from really far, it can be the night before and the night of the meeting to allow you time to get back home. I will have mileage reimbursement forms at every meeting. I believe our current rate is 49 cents a mile. For the first time we do a reimbursement for you, our state requires a W-9 form, which does include your Social Security number. We do take great care with that information and ensure that it is shredded after it is used. We only need it the first time. For parent members, we do reimburse for child care. We do have a waiver in place waiving the rule that we can't pay family members for child care because of the unique nature of our program, and that children in our program, we can't just be left with any care provider, that you need to be comfortable that whoever's taking care of your child knows their needs and how to care for them. So we have that in place. I do request RSVP and dietary needs, and usually if there's any threat of inclement weather on meeting days, we have a message posted on Wayla's voicemail early in the morning.
Yes, and we always say regarding inclement weather, you know, we do not want you to risk your life to come to this meeting. So if you feel that there's any danger or anything like that, please just let us know. We totally understand that. We have no problem with that. We want everyone to be safe, and we don't want anyone to you know, be in danger or anything because of traveling for meetings. So normally if we post the notice on my phone early in the morning, that doesn't help people that have already come from out of town or something like that. So generally, unless it's just impossible for anybody to get to the meeting, we generally have the meeting. But again, if we're having the meeting and you don't feel safe, please just let us know you're not going to be able to come, and we entirely understand that.
And so we have our meeting set for the coming year, beginning with our two-day planning meeting next week, September 8th through 9th. We're going to be at the Hampton Inn in Colorado Springs. And then we also have our regular quarterly meetings. The first one is November 2nd at Imagine, which is in Lafayette. It's Boulder County. Wednesday, January 25th. 2017 will be at DDRC, Developmental Disabilities Resource Center, which is in Lakewood, which is Jefferson County. April 19th, 2017 is at Developmental Pathways in Englewood, which I believe is Arapahoe County. And then Wednesday, June 7th, location to be determined. We usually have this at the Daniels Fund. I can't reserve the meeting space until closer to the meeting date, but we might also do something else somewhere in the metro area for that meeting.
Right. So all of our meetings are in the Denver metro area this time, and we always post the agenda with the address of the location, and Tracy also sends out emails ahead of time. So anytime she sends out a request for information or RSVP or anything like that, if you can please RSVP to her, that helps us so much. Sometimes if people aren't going to be able to come or something, they will just not respond, and then we don't really know. Then some people say, well, I'm going to be there every time, so just assume that, and we can't really do that because we know that there are things that come up. So please just let us know, yes or no. We totally understand when things come up and that sort of thing, but it just helps us to know so that we can plan for our supplies, our materials, our food, our meeting space, and that sort of thing. So we thank you in advance for doing that. So finally, I think we just want you to think about how you will participate as a member of the CICC. We really want you as a part of the group to ask questions. We want you to participate whenever we have group activities, which we do at every meeting. We also want you to keep your role in mind. Think about who it is that you're representing, the things that we're discussing. Think about the impact to the group that you represent, and share your perspective, because that's why we have you on the council and representing the people that you represent and the groups that you represent, because we want to hear your voice and what that means. We know that sometimes we don't think of everything and every ramification regarding different groups, so that's why we have the CICC and want to make sure that we get that input. And then we also hope and expect that you will share the information that you receive at the CICC with the people in your circles. So I know, Jennifer, you're representing Head Start, so if you hear of things, we expect that you would share that with other people that are connected with Head Start. Same thing with Child Find and the school districts, Deb, as you are participating as part of the CICC. I know you don't have access to every single person, but in your circles, the people that you coordinate with, we appreciate that you share that information. One of the documents that I asked you to look at is a document that is called an overview for state interagency coordinating council members. And it was actually developed by one of the regional resources centers in 2006. So it's about 10 years old, but it still has a lot of really great information about the role of CICC members and how you will participate. There are some things that are not the role of the CICC, and some things that are. And so this document really lays that out and talks about how you can really participate and have meaningful input into the CICC. So I would recommend taking a look at that. We'll give you a hard copy of that in your binder that Tracy will make for you and give to you at the planning meeting. So I guess finally, do you have any questions? And I know that you missed, some of you missed the very first part, and so we'll have this recorded. We hope it recorded. I think it did, and we'll post this on our website on the orientation materials, hopefully later today, but definitely by tomorrow. And you can, if you want to listen to that first part that you missed, we're happy for you to do that. The quiz, Deb, as soon as possible, I would say, if you are able to do it before the planning meeting, that would be really helpful. I think it's 10 questions or something like that, so it's not very long. And it's like a Survey Monkey, so you just do it on the computer. It's a requirement of our department. I don't know what they do to you if you don't do it, but I don't want to find out. So if you can just do that by the planning meeting, I think that'd be great. Any other questions? You're welcome. Well, if you do come up with questions, please, anytime, I'm happy for you to give me a phone call, an email, Tracy as well. We work closely together, so, you know, if you email her, she usually consults with me, and vice versa. We check in with each other. And so please feel free to ask us questions. No question's a dumb question. Sometimes we don't think of things, and people have questions about it, so we want to make sure that you feel comfortable and confident as being a part of this Colorado Interagency Coordinating Council. And again, we just thank you so much for your time, for your service to the state of Colorado and to our program in this way. We're really, really grateful for that. And we really appreciate the commitment that you have, because we know that the reason that you all do this is because of your commitment to the children and families of Colorado. And we admire that so much about our members. So with that, we will sign off. And if you, again, have any questions, we're happy to happy to chat with you, and we're looking forward to seeing you at our planning meeting coming up in next week. Yikes, next week. All right, thank you.